It's still Sound Health on Lagos Television, and today on the show our focus is a brain disorder also known as epilepsy, and we'll try to dispel some myths and misconceptions about epilepsy. Seyi Aragbada has put together a paintball to enlighten members of the public. Welcome to the show.
Thank
Hello,
you
how
for
are
having
you?
us. Thank you for coming here. It means a lot to us.
So why did you put together this paintball? Why paintball?
Okay, so a lot of people do not like to associate with anything that has to do with epilepsy. So the only way we can make them come to us is to create something fun that people will enjoy. So the paintball is just one of the fun things that we do to just encourage the public to be a part of us.
Okay, so what has been the awareness like? Has it been receptive? Has people been receptive?
It has been, because this is the first edition, and I mean, you could see the turn up yourself. So being the first edition and we could get this amount of people, it means that people are interested in being a part of fun things and then still raising awareness at the same time.
Oh, from your experience, how aware are people
Okay,
about epilepsy?
A lot of people in Nigeria do not know jack about epilepsy. The only thing they associate with epilepsy is the tonic-clonic seizure, which is where people fall down and start to convulse and foam things out of the mouth. But there are over 45 types of seizures. So we have a long way to go, but we're getting there. We're moving.
What do you think can increase the awareness level?
Okay, so I feel like there are a lot of foundations already in Nigeria that are trying to sensitize people and help people with epilepsy. But if the government can just come in as well, I mean, it will go a long way, because there are over 3 million people living with epilepsy in Nigeria. And that's like the size of a country in another place. But then nobody's acting like we exist. I'm also a person living with the condition. And I will say for a fact that if the government can just come out and just represent us, or at least speak up about this, it will go a long way.
What are the myths and misconceptions you've heard about epilepsy, and what do you intend to do in terms of dispelling some of these myths and misconceptions?
Okay, so one of the major myths is that it is contagious and that you should not touch somebody with epilepsy, you just catch epilepsy. And that was why we created the Don't Label Me campaign. So the Don't Label Me campaign, the Paintball for Charity is still a part of the Don't Label Me campaign. The Don't Label Me campaign has like over 10 campaigns underneath it. We visit schools, we go to communities, we go as far as going to organizations to talk to people that, oh, this thing is not contagious, you can catch epilepsy, and then you can live well with it, because I also live well with the condition.
Okay, so this will be of help to some warriors out there now. What's your daily routine like, and how have you been able to rise above the challenge? Okay. Or the challenges of this condition?
In terms of stigmatization or living well with it?
Stigmatization and living well with it.
Okay, it's a lot. So in terms of stigma, number one, people are always going to have things to say. People are always going to say things. People are always going to have their own advice. So people, if you go to some hospitals, they will even tell you, no, it has to be a herbal kind of treatment to help you. You're going to hear a lot of these things. But if you make up your mind to understand that it is not their fault, rather it is ignorance, I feel like you will not let whatever they say affect you. So the first thing is you have to grow a thick skin. People are going to say things to you. And then the second thing is that you need to see a neurologist. If you've not seen a neurologist yet, see a neurologist so that you can know the kind of thing that would help you control your seizure. Either it's medication, or you need to do a surgery, or you need to be on a diet. Your neurologist will help you with these things. And if it is medication, never miss your medication, because that's one of the major triggers to seizure. And always carry water around. Drink water, stay hydrated at all times. And don't stress yourself.
Okay, so what can be done to help or give relief to people living with the disorder?
One thing, don't stigmatize. I feel like one of the major things that hurts us the most is the fact that nobody wants to associate with us. There are people who actually deny people of marriage because they live with epilepsy. They don't want to get married to that kind of a person. So some families don't want warriors. I call people living with epilepsy warriors. We don't use the word epileptic. So if I say warrior, so you understand what I'm saying. So basically, I feel like if people can just learn to accept that this is not as scary as people think it is, then people living with epilepsy can then come out and speak up about their condition without having the fear that they're going to be labeled, or they're going to be stigmatized, or they're going to be judged. I think that's one step to it.
Okay, I must commend your courage. I'm actually proud of you because you're courageous to advocate this cause. And so what advice do you have for people living with the disorder, the warriors?
If you're a warrior and you're watching this, if you're a person living with epilepsy, I want you to know that it is not your fault. It is nothing to be ashamed about. If people living with HIV/AIDS can actually come out and say they live with HIV, people living with diabetics, people with cancer can come out to speak up about it. I don't think you should come out and, when people say, are you a person with epilepsy, and you're ashamed to say, you shouldn't. You shouldn't be ashamed. You're not alone. And if you need help, you need anybody to talk to, you can reach out to us. through our Instagram, Twitter, and Facebook at Epilepsy Nigeria. Send us a mail, epilepsynigeria@gmail.com, or visit www.epilepsynigeria.org. You're not alone.
All right, thank you so much, Seyi Aragbada, for sharing your expertise and your thoughts on how to manage and live above epilepsy.
Thank you. Thank you guys for coming through. We appreciate it.
I wish you all the best.
Wish you guys all the best as well. Thank you.
Okay. All right, that has been Seyi Aragbada, founder, Epilepsy Foundation of Nigeria. She has been trying to dispel some myths and misconceptions about epilepsy and how to overcome and manage the brain disorder. Sound Health continues with trending and home essentials. Please stay with us. Okay, from your experience, Dr. Bankole, how aware are people when it comes to epilepsy?
Oh, that is actually, I would say is an overstatement. If we say how aware, I would rather say how ignorant are people about the word epilepsy. Actually, I'm here today and I'm glad I'm actually part of this. I actually participated to shoot the short me, and the joy of the whole thing is just that we're trying to create awareness about what people don't know. Okay. Everybody hear the word epilepsy, and what comes to our mind is someone falling down and possibly jacking, hitting his head on the floor. And even if we think about that, none of us have actually thought of what we could actually do to assist them. Okay. But the essence of this is trying to bring people around to a kind of calling their attentions, you know, to the plight of these people living with this condition, because some of them are actually ill. So we need people to realize that there are things we can do. There are things we can do to actually help them whenever they actually have this attack or seizure, as it is called. So as a medical personnel and as a neuroscientist, I've had a kind of experience with several kinds of patients with different kinds of seizures. You will be surprised to know that we have more than 45 different types. But every one of us talks about the generalized tonic-clonic, which is someone falling down and, you know, jacking and all those things. So if every one of us could know, perhaps it could be a step forward towards cure of the ailment.
From my chat with one of the person living with disorder, she said there are no free drugs, unlike for malaria and all that. So what advice do you have for government in terms of medications and support?
Apart from the fact that there is no free drugs for those living with epilepsy, the medication is quite expensive. And someone with epilepsy, and when you want to actually stop the seizure, the person will be placed on drugs for like minimum of 3 years or 3.5 years. And that drug will be taken every single day. And that drug is not so cheap. It's not so cheap. You're talking of a drug that the person will be paying close to like maybe close to 8,000 per month. Okay, and the person will use it consistently for like 3.5 years. So if someone is well to do, you're rich, yes, there's no problem. But what about those coming from villages, those children of those who their parents are selling peppers and all those things that doesn't have the money? Who is going to take care of them? And this is actually the area where government can come in. And that is the reason why we feel there is need for advocacy. There is need for policy that will create a kind of concern for those living with epilepsy, so that when policies are passed, these people too will be taken into consideration, because it is not all, so to say, people living with, how will I call it? People living with epilepsy can also be referred to as handicapped, so to say. Are you getting it? So it's not every one of them that you are going to see it in their face. Some people, you only see it when they have the attack. Okay, and because people don't know, they see some of them, you know, they talk around, they play around. You only see them when they fall and you don't get to know that they are also, they also need to be taken care of. Okay, and a lot of people died as a result of this. When you're talking about statistics, we have more than 3 million people in Nigeria living with it. That's quite a lot of numbers, and which a kind of demands that a government should look into their case and possibly help them too. We're looking forward to a time when Nigeria or Africa will have a place that we're going to call an epilepsy center, where people living with epilepsy will go, they kind of take drugs on the subsidized or free. They need to see a doctor, they will see someone that will consult for them. They need to carry out some diagnostics, they will see someone that will take care of them. Okay, we're thinking of, we've done it for cancer, we've done it for, what's it called, every other diseases. Why is it that government are shying away from this, which is actually very important too as well?
Okay, thank you so much, Dr. Bankole, for sharing your thoughts about epilepsy.
Yeah, you're welcome.
You are watching Sound Health on Lagos Television, and today we are at a paintball competition to raise awareness for epilepsy, a brain disorder. And I have with me 2 members of different teams that participated in the paintball competition. I have with me Rejoice Chukuma and Peace Godi. So, before now, what has been your knowledge about epilepsy?
Okay, what I know about it is a brain disorder, and there's a big problem with the society we are in. There is the problem of stigmatization. Yeah, so people stigmatize and make people feel like, oh, this is your disorder and this is it, you're not part of us. Okay, I was asthmatic for 18 years of my life, and the way people treated me was very, very bad. When I go to the hospital and the way the doctors even ask, like, oh, stay, you have asthma, don't come close to other people so they don't contract it. And it was very, very bad. And I feel we can do better, the society can do better. And we should take everybody as one and fight epilepsy.
For now, have you labeled people with epilepsy?
No, not at all. No.
Okay. After this paintball competition, has your orientation changed? What's your orientation like?
Very well. I think people with epilepsy can actually lead active lives. Like, there's no need to stay indoors, come out. We need to see you. Society should please not judge. I beg, we beg now.
Do not label anybody living with epilepsy, also known as a brain disorder. All they need is your care and support. This is how far we can go on today's episode of Sound Health. For comments and inquiries, please send SMS to 0035 826603 or follow us on social media at TLTV Social. Hashtag Sound Health. It's Sound Health. It's a sound mind. Make healthy living your choice.